Hello everyone and welcome to Meddysimplified. So today we will discuss how can we clear Fmge exam in 100 days. That's the topic of today. That is the 100-day strategy for clearing Fmge exam. What is Fmge? It's a foreign medical graduate exam, usually done in twice a year. It's a licensing exam for a foreign medical graduate to practice in India. Okay, what else? It's consists of 300 questions and from the 19 subjects of MBBS, divided into two parts. 50 questions each part. The one mark for one correct answer and no negative marking. So I'll suggest if you are appearing this exam any day, do not forget to mark or to try all the questions, because you may never know which fluke of yours will give you score and help you passing your exam. So part one includes pre and paraclinical subjects. Part two includes the clinical subjects. So what is the plan? So the plan is 60, 25, 10, 10, 5 plan. 16, 25, 10, 5 plan. So what is the 16, 25, 10, 5 plan? Before going with it, let me tell you that this plan will work only and only if you are well equipped with all your study materials and you do not have any kind of doubt from where you need to study which subject. Once you are done with this, then start with this plan. Okay. So what is this plan all about? It's 60 plus 25 plus 10 plus 5. That is in all 100 days. So what is the basis? How can you clear it? What can be the driving force? So if you practice this thing, that is on each day in this 100-day, you give 8 to 10 hours a day for your preparation. That is it will be in total 800 to 1000 hours, and if you can give more than 10 hours some days, it will be even more than that. So this is why I think that it's possible to clear this exam if you give around 1000 or even more, some few more hours of your life for this exam. So what you need to do in first 60 days, you need to do your first reading. Okay, and the first revision in the next 25 days, and in the next 10 days the second revision, and the final 5 days, that is the crucial 5 days, which we will discuss now. I will discuss each step one by one, what you need to do in which step and how should you approach your reading and revision strategies. So first reading in 60 days. So how is it possible? So first you need to start, give your 7 days for anat and biochem, and this is how you will start your preparation. Okay, first 7 days for anat and biochem. Then you need to give 6 days for ophthalmology and ENT, 3 days for each. Why I'm telling you to do ophthalmology and ENT so early? Because it's one of the scoring subjects. These both are the scoring subjects from paper 2, and which will help to increase your mark more than 150 for sure any day. Then you give 5 days to microbiology, and along with microbiology, you need to give 3 to 4 hours once you are done with micro in this 5 days for infectious disease, which is a part of dermatology. So why I'm telling you, because when you are done with the microbiology, this part of the derma will be like a cakewalk for you. Going further, once you're done with microbiology, what should you do next? You can go with pharmacology, antimicrobial agent, and you should give 1 day, that is approximately 12 hours in this day for this part, that is antimicrobials. Or else you can take 6 days and along with for microbiology, but along when you complete bacteriology, you do antibacteriology, antibiotics. I mean, if when you are done with virology, you need to do antiviral, and this way you need to complete all the antimicrobial agent, including anti-TB and anti-HIV drugs in 1 day, or along with microbiology, then you can give 6 days to your microbiology. After this, you should do physio, patho, and pharma in 8 days. Looks weird, but it is possible if you follow a strategy, that is system-wise approach. What does this mean? First, you do a general part of physio, then general part of patho, general part of pharma. Combine them, and this will add up to your knowledge of medicine also. So this is what I want you to do, that you go with system-wise approach for this subject. So what will you do? Start with the general part of all the subject, then CVS of physio, CVS of patho, CVS of pharma. In the same way, you can do CNS, respiratory, GID, and also endocrinology, and then the remaining part of all the subjects. And this is how you can also form a very good base for your medicine subject. In this 27 days, what you are done with. You are done with 8 subjects, which can give you approximately 132, which carries 130 to 140 marks, and you can definitely score around 100 marks in these subjects if you go well in your further preparation. What next? And then you need to give your 1 day for anesthesia. Then you after that you need to give your 4 days for the important topic from pd and medicine. Not all the topic, I repeat, important topic. Like there are some table, there are some scoring system, there are some diagnostic criteria, all those important part of medicine and pd, and you need to do it. That's it. Because medicine, if you go into depth, it's like an ocean. And even if I give you Harrison and I tell you to complete it in 100 days, and like study it for 100 days, and then I'll ask you a question, I'm sure not only you, even I can't answer anything. Uh, I can't answer. I will not be able to answer few questions if I do 100 days for this medicine from Harrison. So how can I expect? How can we expect to do it in this 4 to 5 days? So it is not possible. That's why I'm telling you, important topics and important part of this subjects you need to do in 4 days, which is very much possible. Then after that, you give 1 day for general aspects of radiology, like the basics of radiology, interpretation parts of how to identify PA, AP views, how to differentiate between CT and MRI, what are the importance, etc. Such kind of thing you need to do in 1 day. After this, you give 2 days for FMT, that is forensic medicine and toxicology, and trust me, it is very much possible to finish this subject once in 20 hours. Then you need to give 20 days, next 20 days for surgery, obs gynae, and PSM, which these 3 subjects in combined will give you will consist of approximately 90 to 100 marks. And if you give your 12 to 14 hours a day for next 20 days, I'm sure that you will be able to attain very good knowledge in this subject. So 20 days for surgery, obs gynae, and PSM. How, in which order, it's up to you to decide. But you need to give 20 days for this subject, which carries approximately 30 marks. And remember, not 8 to 10 hours for this subject in 20 days to finish. You need to give your 12 to 14 hours a day. After that, you can give 1 day in which you will need to learn the important science from radiology and few important topics from psychiatry, like bipolar disorder, schizophrenia, personality disorder, from where majority of the time the questions are asked in FMG exam, because it consists of only weightage of 5 or maximum 7 marks in this exam. After this, you give 3 days for ortho and derma. Derma, a short part you had already done when you did microbiology. The remaining general part of derma and the papillosquamous disease, which is a very important topic, along with orthopedics, you need to do in 3 days. Pull up your socks and follow this thing for the next 60 days when for your first reading. After this, then comes the part of your revision from the next for the next 24 for the next 25 days. But few things I want to tell you. During your first reading time, you need to give at least 30 minutes every day for MCQs. And then 2 more important things I want you to notice: that if you complete the subject before the targeted time, try to revise something you are done with. Like suppose you are giving 2 days for FMT and you finished it in 15 to 16 hours, and you have the 4 hour or 3 hour or 2 hours in the next day for and when you are preparing FMT. Give your 2 or 3, which how many hours you are left with, to the subject you have already done, like anat, biochem, patho, physio, pharma, or microbiology. Similarly, during anesthesia notes are very smaller, like 40 to 50 pages. It is possible to do it in 8 hours. And that day you should give 2 hours for the subjects you are already done with. So that's what and then second thing is that if you are not done with your subjects in the targeted time, do not regret. I repeat, do not regret. Because even if you complete 70 to 80% in your time, it's very much appreciated. And what should you do? If you are done with 70 to 80% of the subject in your given time, you should go forward for the next lot of the subject. Because if you think that I need to give 1 more day to this subject and then I'll try to compensate it, the time management will not be possible, and you will then tend to do this for further time. So I think you should not do you should set your target and should stop the subject however how much ever you have completed till the targeted date and go to the next subject. So this was about first reading. Then the first revision, that is in the 25 days. What you need to do, start with the subjects of part 1. Okay, why I'm telling you, because part 1, 150 marks from 8 subjects: anat, physio, biochem, pathopharma, micro, fmt, psm. And this subjects usually one liners are asked and you can easily score marks through them. So I hope you should be very well with this subject, because if you can score 150, 100 out of 150 in the paper 1, your marks will be like I don't know what to say, that it will be very good marks which you will achieve in your exam. So start with the paper 1 subjects. Then try to revise physiopatho-pharma in the same manner which you did in first reading, because this will give you case understanding and solving approach for medicine questions, even if you don't prepare medicine well. And according to this strategy, I'm not forcing you guys to prepare for medicine well. So this strategy going systemic wise will give you a good base for medicine, and you will be able to tackle few questions, I guess, from medicine too. After this, in paper 2, start with ophtha and ENT revision time. Then go with the surgery obs-gyna, and then do the remaining short subjects. If you can do this in 25 days, time management, it's up to you how you want to. But if you give you 8 to 10 hours, I'm sure that you can do this revision in 25 days. Then second revision in the 10 days. It's very important to divide your 10 days into 4 plus 6. What will you do in this 4 plus 6? Part 1 in the first 4 days, and the next remaining 6 days part 2. Or you can do one more thing. Sorry, you can do paper 2 on the first day of your second revision. Then on the second day, you can do paper 1. In this way, you can carry for the next 8 days, and on the last 2 days of your second revision, just do paper 2. In this way, you will divide it in 4 and 6, and you will be doing the subjects according to your interest. But make sure you do not give more than 4 days to paper 1 and not less than 6 days to paper 2. To the way you feel comfortable, but important is timing. And remember the days, number of days you have. So 4 days for paper 1 and 6 days for paper 2. Then last 5 days before exam, most crucial time. What you need to do, you need to divide your 5 days into 3 plus 2. And for the first 3 days, try to revise your stronger subject. I repeat, do not go behind your weaker subject in the last 5 days, because you will, even if you revise them in the last days, you will tend to make mistakes. But if you revise your stronger subjects in the last 5 days, there is a high probability that you will score out of marks in those subjects questions. So please try to make your stronger subjects even more stronger in the last 3 days. Then what you need to do in the next 2 days, revise just images, just look at the images, revise one-liners, important tables or diagnostic criteria from medicine and such things like important science and all the one-liners, etc. Do not go behind any subjects revision in the last 2 days. You can go with the tables or important timings for the from the PSM. Okay, you can vaccinations. You can do the biomedical waste management, such things in the last 2 days. Do not go with the whole subject in the last 2 days. Help your mind to solve MCQs from the okay, one more thing which is left, that from the first revision day, increase the timing for your MCQs. First you were giving the reading time 30 minutes, now you start giving from the first revision more than 1 hour for your MCQs. MCQ solving will play a very important role in all this period of your preparation, because, and most importantly, if you can give mock test, try to give mock test every 7 days, after every 7 days, or even after every 10 days. That will be good for you. Make sure that you give mock test, because even if you're not prepared with all the 19 subjects, go for the mock test. You will learn how to make flukes. You will learn how to make the tukka. Okay, so go with the mock test every 10 days, at least minimum every 10 days you should go with the mock test. This will train your mind for the thing like how exam occurs, that one question from anat, another from patho, then another from pharma, then another from micro, PSM, like this, your brain will be trained. So do solve MCQs, and most importantly, mock test before during your preparation time. So last 2 days, remember images, one liners, important sign, etc. Do not go with the subjects in the last 2 days. So, and very important thing, in the last 5 days, don't panic and stay positive and spread positivity, because you will have a lot of your friend who will be panicking, who will be very anxious, who will be talking negative. So make sure that you do not panic. You stay positive and spread positivity, because it's very important on the day of exam that you do not feel negative. So this was all about the 60 25 10 5 plan. Hope you liked it and hope you find useful. Thanks for watching the video. Hope you liked it. Please comment down and comment down that how did you if you have used this technique, if you have used this approach even for your preparation, let the people know how it is useful. And if you are using this technique and you get success in your exam also, then do not forget to comment down. Hope you like the video. Please share it with your friends and spread positivity. Hope one day the as the earlier the result was 3%, now it has reached 30%, the passing percentage of FMG. Hope in the upcoming days it goes more than beyond 50 and 80%. So like the video, share the video, and subscribe to my channel Meddysimplified. Thank you.